Good morning. Today we will see the remaining portions of medical surgical nursing. The first question is fruit and fruit juices are restricted in patients with chronic renal failure. When the kidney fail, they can no longer remove excess potassium, so the level buildups in the potassium. A high potassium level in the blood called hyperkalemia, which may occur in people with advanced stage of the chronic kidney disease, and some effect of this high potassium is nausea, weakness, numbness, and slow pulse. The fruit juice and fruits like orange juice are high in potassium, and it is better to avoid the patients with chronic renal failure, because that may increases the potassium level in the body, and even it can affect the heart rate level. So it is better to prevent the fruits and fruit juices. Reverse isolation is practiced while caring patients with leukemia. The reverse isolation is designed to protect the person from other people's germs, or opposed to protecting other people from a patient who might be sick. That means it is a person who is prone to get infection. In those cases, we practice reverse isolation. So in leukemia, recurrent infections can occur because of the body is not producing enough white blood cells to keep the immune system working properly. And sometimes they may be on chemotherapy, that may again increases the risk for getting the infection. So reverse isolation of hospitalized patients with acute leukemia is common practice to protect them from serious infections. Next question is, urine output is closely monitored in patients with gastroenteritis. Acute gastroenteritis is a common infectious syndrome causing combination of nausea, vomiting, diarrhea, and abdominal pain. A frequency of volume passed in the preceding 24 hours is fairly a reliable guide of hydration status. Clinical signs of dehydration may not correlate with laboratory findings, and therefore urine electrolytes have limited value in the assessment of degree of dehydration. So that means before the blood examination sent to the lab, and by the time we get the result, it may be the patient will be already on dehydration. So if we are closely monitoring the urine output is minimum 30 ml per hour for a healthy patient. So if the urine output is less than 30 ml, it indicates that the patient is on dehydration, and we can give adequate fluid to the patients either intravenous. If the patient is having severe diarrhea and vomiting, we can give the fluid by intravenously. Thus we can prevent the patient from dehydration. Patients with meningitis preferably nursed in a room with a dim light. Meningitis is an inflammation, that is swelling of protective membranes covering the brain and spinal cord. A bacterial or viral infection of the fluid surrounding the brain and spinal cord usually causes swelling. Symptoms include headache, fever, and stiff neck. Intracranial conditions such as meningeal irritation from the meningitis cause photophobia, thought to due to irritation of basal meninges, especially around the diaphragmatic cell. So, if the patient is patients with meningitis are treated with the dim light, the cerebral irritation can be decreased. After cardiac catheterization, the limb used for cannulation is immobilized. Cardiac catheterization, also called as cardiac cath or coronary angiogram, is an invasive imaging procedure that allows the doctor to look at coronary arteries to diagnose coronary artery disease. After cardiac catheterization, the limb usually for used for cannulation is immobilized to prevent bleeding. Client on antihypertensive drug should be cautious while moving out of the bed on awakening. Antihypertensive agents reduce sleep blood pressure, causing postural hypotension, dizziness, syncope, headache, lethargy, or other symptoms. So they should be cautious while they're getting out of the bed. If they suddenly get out of the bed, it may cause a dizziness and there's a chance for them to fall. So a patient is on antihypertensive, before they getting out of the bed, they should sit at the corner of the bed for some time, and then they feel okay, then only they have to be get up. Otherwise, sudden getting up of the bed from the bed may cause postural hypertension, and this may cause in the falling of the patient, and the head can hit somewhere and the injury can happen. So it means they should be very cautious when they get out of the bed. Patients are nursed without pillow after the lumbar puncture. The post-dural puncture headache or PDPH is a common complication of lumbar puncture. It can happen when some of the spinal fluid is removed. So this headache can be relieved when the patient is lie flat on the bed. So the patient should, after lumbar puncture, should be nursed without pillow, flat on the bed. Sweeping motion is used while retracting catheter during suctioning. Sweeping motion is used while retracting catheter during suctioning because this movement prevents the catheter from suctioning into the oral mucosa and causing trauma to the tissues. And positive end pressure is done in acute respiratory distress. Acute respiratory distress syndrome or ARDS occurs when the fluid builds in the tiny elastic air sacs, or otherwise we call it as alveoli in the lung. The fluid keeps the lungs from filling with enough air, which means less oxygen reaches the bloodstream. Positive end expiratory pressure keeps the airway zone, small lung spaces open to allow adequate oxygenation when a person cannot breathe their own. If the lungs cannot oxygenate properly, the individual may need to intubate and place on mechanical ventilations to allow the lungs to heal. A positive end expiratory pressure widely used to improve the oxygenation and prevent alveolar collapse in mechanically ventilated patients with acute respiratory distress syndrome, because it helps it will not allow the alveoli to, because of the positive pressure, it will keeps the alveoli without collapsing and the air exchange can take space. That is why positive pressure should be used in the patients with the ARDS. The last one, covered wounds heals faster. Covering the wound maintain natural moisture that keeps the kip cell alive, so epithelial cells migrate faster in a more moist environment. In the final stages of wound healing, epithelial cells migrate across the surface of the wound to close it. These cells need the moisture to move across the surface of the wound. This is the reason why covered wounds heals faster. The wound that heals in a moist environment is less likely to leave a scar. So because of these two reasons, the wound should be covered. The covered wounds will be healing faster. Thank you. Thank you for listening.